Welcome back to Healthwise with our special guest, Dr. Kevin Guillory with Family Medicine. Doc, we were talking about diabetes earlier, and we were talking about some of the symptoms. You mentioned about the eye check. What do you check with the eyes?
Well, what happens is, like I said before, that people with diabetes, and the reason that this happens, when I say the numbness in the fingers and toes and the eyes, that what happens with diabetes, that it likes to attack the small blood vessels. So that's why a lot of times it happens, the numbness and tingling in the fingers and toes and the eyes. And what I mean by an eye check is we usually like our patients with diabetes to be checked yearly, at least once a year, to get it checked by an ophthalmologist, optometrist, where they dilate the eyes and they take a look to see if there's any disease in the eyes, what we call diabetic retinopathy. And what can happen is sometimes the blood vessels can get blocked by just all the complications that are caused by diabetes, causing the blurry vision or loss of vision. And so what we like to do is just send them to a specialist, send them to the eye doctor, and they'll dilate the eyes and just see if there's any disease. And if there is, the eye doctor will take care of it, but that just means that we need to get better control of the sugars because it's gotten to the point where it's attacking the eyes.
Wow. Okay, and that's why, a lot of people that have some kind of blindness or whatever, when you ask them, they'll tell you, I was diabetic. I mean, that explains why. Also, with diabetics, why, they always tell you about the sores and about you should look for any kind of sores that don't heal.
Yeah.
Why is that?
Yeah, I'm glad you brought that up. A lot of times with diabetes, they can get sores that normally don't heal. And the reason for that is because of poor circulation. We need good blood flow for sores to heal. And what can happen with diabetics, particularly with sores in the feet, what happens in there is because diabetes attacks the small blood vessels, when you get sores in the feet, they can lead to ulcers, and that can lead to further complications. When the sugars are not under control, it can lead to where the ulcers expand and don't heal like they're supposed to. And what can end up happening if it gets real bad, I mean, there's wound care and everything, but if it gets to the point where the sores get to the point where we like to call it what they say gangrenous, meaning that it's just basically the bacteria is eating the flesh, that at a certain point they may lose the feet. So that's why it's very important for people with any of the signs of diabetes, especially with a family history, to get checked. And even if they see sores in the feet and they notice that it's not healing, or sores anywhere that they think it's, that something's not right, it's not healing well, then that's a sign that maybe it's diabetes and you should get it checked.
Sure. Okay, and we were talking about lifestyle. What do we do different once we know we have diabetes? What do we do different in our lifestyle to make,
Well, like I said, like I brought up before, our diet here it's a good diet, but it's not good as far as blood pressure, diabetes goes. But what can be done, and it's not just diet, it's exercise, but diet consists of, you don't have to cut out all the carbohydrates, because we do need carbohydrates. When I mean by carbohydrates, it's like the white rice, breads, stuff like that, but there are better sources of that, meaning whole wheat. So instead of white rice, you can do brown rice. Instead of the white bread, you can do whole wheat bread, which is good for fiber, which helps lowering sugars. Also fruits and vegetables, just avoiding not just the sugars, but also the fattening foods, the fast foods, the salty foods, because another complication that goes along with diabetes is blood pressure. So just cutting back on the salt, cutting back on the sugar, and also doing exercise, whether it's walking a mile a day or doing some kind of strenuous activity, at least half an hour to an hour a day, to kind of help with the weight loss, because the more weight you lose, the better that your sugars will be under control. So just doing lifestyle modifications with diet and exercise is very important with diabetes. It's not just medicine, and if you can even avoid the medicine, that'd be great. And I like to tell my patients, it just depends on where you're at, where your sugars are. Do we need medicine or not, or can we just do lifestyle modification? And if they're at a point, say their sugars are between 126 and maybe 180. I like to say, well, you know, we can do lifestyle modifications for 2 or 3 months, and then at a certain point we can, you know, recheck down the line, recheck in 2 or 3 months. If we're still at a certain level, if we're still at that level, then maybe we can start medicine. But if we're not, and if we're getting worse, then we'll, you know, we'll add medication like we need to. But if it's getting lower, just by what they're doing, then, you know, they don't need the medicine.
So that's a good thing, that maybe if you catch it early enough and you go to your doctor, then by just changing the way you eat and what your lifestyle is, there's a good possibility that you can
avoid the medicine. And another thing, even if you have to be on medicine, if you make these lifestyle changes, then at a certain point, if you're doing well, your fasting sugars are below 126 or getting even below 100, we can do a trial off the medication and stay with the lifestyle modifications, and you may be able to stay off the medication, which can happen, you know.
Oh, yeah, that's good to know, and it's just a matter of making some good decisions with the help of your doctor.
That's correct.
And being able to, you know, just change what we eat, diet. It's real simple, you know, and exercise. Right. And I know, you know, after we come back from our next break with the sponsor, we're going to talk a little bit about, I guess, the different medicines and what they are, and, you know, what's some of the, I guess, the good things we can talk about, some of the success stories, and also let people know that, yeah, there are people that have to keep taking it, but, you know, we can go from there. Okay, well, after this brief break from our sponsors, we will come back and talk some more about diabetes.